we are going to bring in Ruthanne Sudderth. She's the Senior Vice President for Public Affairs and Communications for the Michigan Health and Hospital Association. Great to have you with us here on the Oakland County MegaCast.
Good morning, Ronnie. Great to be here. Thanks for having me.
Ruthanne, for those not familiar with the Michigan Health and Hospital Association, can you fill us in on your mission and your work?
Absolutely. The MHA is 101 years old. We are a statewide trade association representing hospitals and health systems across the state. Our mission is to advance the health of individuals and communities, which is in line with our members' mission as well. And we work in the public policy space, advocacy, patient safety and quality, and a number of other areas really to improve access, coverage, and the quality of care delivered to Michiganders across our state.
This past year has been a year like none other. Do you want to talk a little bit about how your job has changed during the COVID-19 crisis?
You know, it certainly has been a year, I think, that has been different for all of us, including our member hospitals and everyone who works in a hospital. And for the MHA, this has really been an opportunity to show value to our members and to help lead our state through a crisis. None of us have ever lived through a pandemic like this before. And so it has been our honor to really help lead the effort with our members to save lives and to communicate to members about how to prevent COVID-19 and to be there for them when they've needed care for either COVID or any other issue that comes along in someone's life. So it has been one for the record books. We are hoping that in the next few months, it will start to improve as we see the vaccine come along, but we have a ways to go.
And talk about the supply chain. Are the hospitals able to get what they need right now for the second surge of the COVID-19?
You know, the supply chain issues have been on our list of challenges throughout the year, whether it's testing supplies or PPE, which is personal protective equipment, the gear that our nurses and physicians have to wear to stay safe when they're on their shift in the hospital, or, you know, now the vaccine that's coming. So we are certainly seeing improvements from when we had the initial surge this spring. We are in a much better place with things like N95 masks and other personal protective equipment, which is a great thing because the first thing we have to do is keep our workers safe and healthy. You know, testing supplies can continue to be a challenge. And so, you know, recently some testing facilities have had to slow down their processes and test people only with a doctor's order or who are symptomatic, because we do need to maintain those supplies for the greatest need. And we also need testing supplies for other types of illnesses. So that continues to be a challenge.
It's like we heard nightmare stories in the beginning, and how, you know, some people on the medical team were wearing the same mask for their, 10-hour shift. So hopefully one of the good things that could possibly come out of this crisis is the supply chain issues have been addressed and fixed long term so that we don't have to go through that again. As we are going into this second wave, what are the biggest concerns for the next 3 months?
The biggest concern we have right now and that hospitals face across Michigan is the health of their staff. As individuals are in the community or spending time with just their family, they're getting exposed because of the spread of this virus. And if they become exposed or ill, they can't report to work and be there to care for you, to care for their patients. So the biggest challenge right now is keeping our hospital staff safe and healthy when they're out in the community or at home. And that's where we've really had to ask and, say it loudly in the last couple of weeks. We're asking Michigan residents to help us protect our nurses and doctors and food service workers and everything else, because we need them to be able to safely report to work. So staffing is a big challenge right now. And because the spread is statewide versus in the spring when it was more regional, we can't share staff as easily because everyone's really stretched thin. So that's really our biggest concern right now, and why we really need Michigan's help to step up and follow the new MDHHS order and help us get out of this.
Yeah, what are your thoughts on the new partial shutdown that was just implemented?
We're very supportive of the MDHHS order that was issued on Sunday evening. We came out with a statement that night supporting those measures because we frankly, can't afford to wait another day or another week with more spread and with our numbers rising. We've seen hospitalizations increase exponentially in the last few weeks. And while we might not be short on beds, it doesn't matter if you have a bed if you don't have anyone to work and staff that bed and care for a patient in that bed. So again, we need people to mask up anytime they leave home. We are urging people to cancel large family gatherings and stay with your immediate family this Thanksgiving. If you're out hunting, please do it safely and not with those from other households staying indoors. These are all things that can really help squash this surge. And we really appreciate the public support in doing that.
Yeah, we hear the balance between the economy and trying to keep the public safe. There are two sides to this coin and to this argument. When it comes to the employees and having enough employees, becoming a nurse is not a quick, easy job that someone can just jump into.
Right.
Do you think after this pandemic, are you hearing that maybe more people want to go into the healthcare industry, or are you afraid that the crisis is going to turn people away?
Well, I sure hope it doesn't turn people away because, the kind of jobs that hospitals have are, secure. They are, not being outsourced. And, healthcare is Michigan's largest private sector employer. Hospitals alone employ nearly 250,000 individuals across our state. And that doesn't include people that work in independent physician offices or any other type of healthcare job, home care and nursing homes, et cetera. So, we need to take this opportunity to, learn from the challenges COVID has presented our workforce and to grow our healthcare workforce. There are opportunities around the state to get into the healthcare field, into good paying jobs, and to grow into those positions. So we hope this is an opportunity to actually grow our workforce and learn from the pandemic and what we can do better next time so that we're prepared.
Yeah, I think we all want to hope that there isn't a next time. But when you do speak with some of the experts, a lot of them are not surprised that this crisis happened. In fact, some people had been warning of such a crisis years ago. So it's definitely been a learning curve. One of the things that we saw back in March and April and May, with the hospitals overwhelmed with COVID, a lot of people that needed medical attention were afraid to go to the hospitals. Do you think we're going to get back to that level?
We are urging people because we did see some of those really sad instances this spring of people avoiding getting emergency care when they really needed it. We don't want that to be the case. People need to understand that if you have conditions or symptoms that you think are life-threatening or urgent, you need to get care right away. And there are measures in place in emergency departments to make sure that you are safe and isolated from COVID exposure. So we absolutely do not want people to delay care. They should seek emergency care, call 911, go to the emergency room if they have any concerns about their immediate health.
How do you think the response during this second wave is going to be different at hospitals across the state of Michigan from the first wave?
Well, we've certainly learned a lot since the spring. And as I said earlier, we're in a much better position with things like personal protective equipment. It's different this time for everyone because the surge is not isolated to Southeast Michigan. We're seeing large numbers of cases and positivity rates in some of our most rural and vulnerable communities in the Upper Peninsula, in Northern Michigan, and they simply don't have as many resources in the geographic area that we do in some communities downstate. And so it's different because everyone's being pulled in a lot of directions at the same time. And it's a little harder to share resources when that happens. And that's why it's so important that even in those small communities where you think you're more isolated and safe, we still need people to wear a mask and stay away from those they don't live with right now, because that's what's going to help their local hospital get through this and make sure they have the resources there to care for you, whether you're experiencing COVID or you hit a deer with your car or whatever it might be here as we enter the winter season.
Yeah, and Ruthanne, while we have you on, can we dive a little deeper into testing? Because we are testing so many more people here in the state of Michigan. I think some of the last numbers I heard, over 50,000 people are being tested each and every day. But it's also creating somewhat of a backlog on getting the results back, as well as contact tracing. What do you anticipate testing levels are going to be like over the next, let's say, 3 months?
The state of Michigan is very dedicated to maintaining those testing levels, if not increasing them. The more cases we know about, the more we can have people quarantine and isolate. What people need to know is that when you're awaiting your test results, especially if you're symptomatic, you should not be out in the community or going to places with other people. You should be quarantining at home while you await your test results. That's how we can ensure, even if it takes 5 to 7 days for you to get your results, which we know is frustrating, that you are safe at home and not exposing others and spreading things throughout the community. So that's one thing we really want people to understand, is that while you're awaiting your test results, you should be waiting at home. We also, sorry, go ahead.
No, and do you think, should some of the college students get tested before they come home, knowing that there could be a shortage of tests?
A test is really just a snapshot in time. So if somebody feels or knows that they've been exposed and they've been alerted to an exposure, or if they're symptomatic, they should absolutely get a test. But a test is not always 100% accurate and is, only accurate for the point in time where that sample is collected. So whether or not you get a test, if you are concerned that you've been exposed, you should take the proper quarantine measures and make sure your family understands. And if those kids are going home, they should, do so safely and stay away from any vulnerable family members. So not everybody has to get tested before they go home. We don't want that to create a false sense of security, but absolutely, if you are exposed or symptomatic, that's something that you should try to do.
Ruthanne Sudderth with us here on the Oakland County MegaCast. She's the Senior Vice President for Public Affairs and Communications with the Michigan Health and Hospital Association, and talking a little bit more about testing. When should an individual get a rapid test versus the other test? I believe it's a PCR.
Yeah, so the rapid tests have not been shown to be as accurate as the PCR test. That is really, the PCR test is the nasal swab, for those who don't know, and that is the most accurate test. It does take longer to get results, though, depending on where you get your test. So whether or not somebody is given a rapid test might be up to their employer. There are places on the MDHH website for COVID that you can find different testing locations. But people really need to understand that the rapid tests are sometimes only 50% accurate. So again, if you think you've been exposed or are symptomatic, that rapid test result really shouldn't be relied on to guide how you take precautions.
And now that we are starting to see so many more people get tested and supplies can become an issue over the next few months, how often should an individual be tested? Because you're hearing where some workplaces are requiring people to have a negative test result before they come back. Yet I've heard too that some people can test positive for up to a few months after the virus has left their system.
Yeah, it's something that should be guided by science and by individuals' doctors, or there might be employer policies that need to be followed. We're really working closely at the Hospital Association with the Michigan Economic Recovery Council on helping employers understand how to have people report to work safely, whether or not they need testing. Every employer is going to be different in that regard. But again, the most important thing is for the general public is to understand that if you are exposed, you need to isolate or quarantine, and you need to get tested, especially if you have symptoms, and stay away from others while you're awaiting those results.
So if an individual maybe was exposed, but they have no symptoms and they've been isolating, should they get tested if they have no symptoms after 4 days or so?
The virus can take up to 14 days to appear as symptoms or to appear as a positive. So you could be exposed a week and a half ago and be asymptomatic, but contagious and spreading the illness. So as soon as you know you've been exposed, you should absolutely be quarantining and taking those preventive measures and wearing a mask everywhere you go. And if possible, to get a test, because that allows the health department to then trace who you might have been in contact with. So while it can take some time to get a test and get results, it's really important for us to understand the nature of the spread.
Wow, it's like we're 8 months into this and we still have so many questions, and there's still so much information to learn about this virus and the spread of the virus as well. Ruthanne, anything I didn't touch on that you want to share with our viewers and listeners before we let you go?
I'll just say again that our workers on the front lines are the heroes of this story. And the best thing that you can do if you want to support the nurses and the doctors in your community and everyone else who works at the hospital doing really important work is to thank them by wearing a mask, staying home, downsizing your Thanksgiving, and making sure our healthcare workforce can stay healthy and safe.
Yeah, they mean so much to our entire community. Ruthanne, thank you so much for your time. We appreciate it.
Thanks for having me.